Elderly people, are you overlooking one of the most powerful healing tools hiding in your kitchen? It's not a supplement, not a prescription, it's baking soda. In this video, you'll discover 13 surprising health problems baking soda may help with, especially for those over 60. As we age, our bodies become more sensitive to inflammation, acidity, and chronic health problems. Baking soda, or sodium bicarbonate, has been used for generations to fight infections, ease discomfort, and balance pH in the body. But how exactly does it help seniors? 13. Acid reflux and heartburn. Baking soda, also known as sodium bicarbonate, is a common home remedy that can offer quick relief for occasional acid reflux and heartburn. When mixed with water, it works by neutralizing excess stomach acid, which helps ease the burning sensation in the chest or throat. This simple solution can be especially helpful for older adults looking for fast, over-the-counter options. However, it's important to use it with caution. Baking soda is high in sodium, which can raise blood pressure and lead to fluid retention, particularly in seniors with heart or kidney conditions. Overuse may also cause a dangerous shift in the body's pH balance. For these reasons, baking soda should only be used occasionally and under the guidance of a healthcare provider. If heartburn is frequent, it's best to address the root cause through dietary changes and safer long-term solutions. 12. Joint pain and inflammation. Baking soda is gaining attention for more than just heartburn relief. Emerging research suggests it may also play a role in reducing joint pain and chronic inflammation. Early studies indicate that a daily dose of baking soda and water might help calm the body's autoimmune response, which is often overactive in conditions like rheumatoid arthritis. By influencing the spleen and immune cells, baking soda appears to promote a more anti-inflammatory state, potentially easing stiffness and swelling in joints. While this is not a cure, and more research is needed, it offers a promising and affordable support option for seniors dealing with chronic joint discomfort. Still, it's important to consult with a healthcare provider before starting any new remedy, especially one that can affect sodium levels and kidney function. Urinary tract infections, UTIs. Urinary tract infections, UTIs, are especially common in older adults and can cause significant discomfort, including burning, urgency, and pelvic pain. While antibiotics are the primary treatment, some people explore natural ways to ease symptoms, and baking soda is one such remedy. The idea is that baking soda, a natural alkaline substance, can help neutralize the acidity of urine. This shift in pH may temporarily reduce the burning sensation and create an environment that's less favorable for bacteria to multiply. Some early reports suggest that when used in small amounts, such as 1/4 to 1/2 teaspoon mixed into a full glass of water, baking soda may offer short-term symptom relief. However, it's critical to note that this is not a cure and should never replace medical treatment. Overuse of baking soda can lead to serious health risks, including electrolyte imbalances and increased blood pressure, particularly in seniors. If you suspect a UTI, always consult your doctor first. Baking soda may be a helpful addition to your care plan, but only with professional guidance. Gout. Gout is a painful form of arthritis caused by high levels of uric acid in the blood, which forms sharp crystals in the joints, often affecting the feet, ankles, and knees. For seniors, these flare-ups can severely limit mobility and independence. Some natural health advocates suggest that baking soda, or sodium bicarbonate, may help reduce uric acid levels in the body by making the blood more alkaline. This shift could potentially ease the intensity and frequency of gout attacks. A common home remedy involves dissolving a small amount, typically 1/4 teaspoon, of baking soda in water and drinking it once or twice a day. While some individuals report symptom relief, it's important to remember that this is not a medically proven treatment and should never replace prescribed medications or dietary changes recommended by a doctor. Also, because baking soda is high in sodium, it can raise blood pressure or cause fluid retention, both of which are serious concerns for older adults. If you're considering this approach, talk to your healthcare provider first to ensure it's safe for your specific health needs. Kidney function support. Chronic kidney disease, CKD, affects millions of older adults, gradually reducing the kidney's ability to filter waste from the blood. One surprising area of research has explored the use of baking soda, or sodium bicarbonate as a potential support for kidney function. When the kidneys start to fail, the body often becomes too acidic, which can accelerate further damage. Some studies have found that taking small doses of baking soda daily may help neutralize this acid buildup, potentially slowing the progression of kidney decline. In fact, certain nephrologists prescribe it as part of a treatment plan for metabolic acidosis, a common complication of CKD. However, this remedy is not without risks. Baking soda is high in sodium, which can worsen blood pressure and heart issues if not carefully managed. That's why it's absolutely essential to consult a healthcare provider before trying it. For the right person under medical supervision, it may be a simple and inexpensive way to support kidney health, but it must be approached with care. Sore muscles. As we age, even light physical activity can leave muscles feeling sore, tight, or fatigued, especially if we're rebuilding strength or dealing with chronic conditions like arthritis. One gentle, natural remedy that's gained popularity is a baking soda bath. Adding about half a cup of baking soda to a warm bath can help soothe sore muscles, reduce stiffness, and promote relaxation. Baking soda works by neutralizing acids on the skin and improving circulation, which may help flush out lactic acid buildup, a common culprit behind muscle soreness. For seniors, this type of bath is not only therapeutic, but also calming, helping to relax both body and mind after a long day. Just make sure the water isn't too hot and always check with a healthcare provider if you have sensitive skin, high blood pressure, or are prone to dizziness in warm baths. When used safely, it's a simple way to support recovery and enhance mobility. Skin irritations and itchiness. Baking soda's gentle alkaline properties make it a popular natural remedy for soothing skin irritations, especially in older adults who often experience dryness, itchiness, or sensitivity. When applied topically as a paste mixed with water, baking soda can help calm inflammation, reduce redness, and relieve the discomfort caused by insect bites, mild rashes, or dry patches. It works by neutralizing the skin's pH and providing a mild exfoliating effect, which can promote healing without harsh chemicals. However, it's important to use baking soda cautiously on sensitive skin. Always do a patch test first and avoid applying it on open wounds or severe irritations. For seniors, this simple, inexpensive remedy offers a soothing option to help maintain healthy, comfortable skin naturally. Bad breath, halitosis. Baking soda, also known as sodium bicarbonate, offers a natural and gentle way to combat bad breath, or halitosis, which can be particularly troublesome for older adults. As we age, changes in oral health, medication side effects, and reduced saliva production often contribute to the buildup of odor-causing bacteria in the mouth. Gargling with a solution of baking soda and water helps neutralize the acids produced by these bacteria, restoring the mouth's natural pH balance and creating an environment less hospitable to harmful microbes. This simple remedy not only helps mask unpleasant odors, but actively reduces the bacterial load that causes them, supporting fresher breath over time. Additionally, baking soda's mild abrasive properties aid in breaking down plaque and food particles that brushing alone may miss, enhancing overall oral hygiene. Since seniors often face unique dental challenges, such as dry mouth, gum disease, and denture use, incorporating baking soda rinses can be a safe, cost-effective supplement to their oral care routine. However, it's important to use baking soda in moderation and continue regular dental visits, as overuse might irritate sensitive tissues. By integrating this natural practice, seniors can maintain better breath, improve comfort, and promote oral health, which is essential for proper nutrition, social confidence, and overall quality of life. Tooth and gum health. Baking soda is a gentle yet effective ingredient for maintaining tooth and gum health, especially important for seniors who may have more sensitive mouths. When used as a paste for brushing, baking soda helps whiten teeth by removing surface stains without the need for harsh chemicals found in many commercial whitening products. Its mild abrasiveness breaks down plaque, a sticky film of bacteria that forms on teeth and gums, helping to prevent cavities and gum disease. Additionally, baking soda's natural alkalinity neutralizes acids in the mouth that cause tooth enamel erosion and irritation to the gums. For older adults who are more prone to gum recession and sensitivity, Baking soda offers a safe way to support oral hygiene, reduce inflammation, and freshen breath. However, it should be used in moderation alongside regular dental care to avoid overscrubbing or irritation. Incorporating baking soda into daily brushing routines can help seniors maintain a brighter smile and healthier gums, contributing to better overall health and quality of life. Body odor. Baking soda serves as a simple and natural alternative to commercial deodorants, making it especially appealing for seniors seeking gentle, yet effective body odor control. When applied to the skin, baking soda works by neutralizing the acids in sweat that cause unpleasant odors, rather than just masking the smell with fragrances. Its alkaline nature helps balance the skin's pH, reducing bacterial growth that leads to body odor. Unlike many conventional deodorants and antiperspirants that contain chemicals and aluminum compounds, baking soda offers a chemical-free solution that's less likely to irritate sensitive or aging skin. It can be used alone or mixed with a little water or coconut oil to create a paste that keeps you feeling fresh throughout the day. For older adults who may experience changes in body chemistry or have sensitive skin, baking soda provides a safe, cost-effective way to stay confident and odor-free naturally. Indigestion and bloating. Baking soda, also known as sodium bicarbonate, has been used for centuries as a natural remedy for indigestion and bloating, conditions that commonly affect seniors due to changes in digestion and slower metabolism. When mixed with water, baking soda works by neutralizing excess stomach acid, which often causes heartburn, acid reflux, and a feeling of fullness or discomfort after eating. This neutralization helps to quickly relieve the burning sensation in the chest and reduce the buildup of gas that leads to bloating. Unlike many commercial antacids that can contain strong chemicals or cause unwanted side effects, baking soda offers a gentle, cost-effective, and widely available alternative. However, because baking soda contains sodium, it is important for older adults, especially those with high blood pressure, kidney problems, or heart conditions, to use it sparingly and under medical supervision to avoid complications from excess sodium intake. Overuse can lead to alkalosis, an imbalance in the body's pH, which can cause muscle spasms or other serious health issues. Despite these cautions, when used responsibly, baking soda remains a powerful and natural way to support digestive health, reduce discomfort from indigestion and bloating, and promote overall well-being in aging adults. Always consult with a healthcare professional before making baking soda a regular part of your digestive care routine. Toenail fungus. Baking soda has natural antifungal properties that make it a helpful remedy for managing mild cases of toenail fungus, a common issue among older adults. As we age, circulation slows and nails become more brittle, making fungal infections more likely to occur and harder to treat. Soaking your feet in a warm water bath mixed with baking soda, typically 1 to 2 tablespoons per quart of water, can help create an environment that inhibits fungal growth. Baking soda alters the pH of the skin and nail bed, making it less hospitable for fungus to thrive. Regular foot soaks, especially when combined with other antifungal agents like tea tree oil or apple cider vinegar, may promote clearer, healthier nails and reduce associated itching or odor. While baking soda isn't a cure for severe infections, it can be a supportive, low-cost, and non-invasive part of your foot care routine. For best results, practice good hygiene, keep feet dry and clean, and always consult a healthcare provider if the infection persists or worsens, as prescription treatments may be necessary in more advanced cases. Immune system support. Recent studies have uncovered a surprising potential benefit of baking soda, supporting the immune system by reducing chronic inflammation. As we age, low-grade, long-term inflammation, often called inflammaging, can weaken immune response and contribute to a range of diseases, including arthritis, heart disease, and even cognitive decline. Early research, including a notable study from the Medical College of Georgia, suggests that drinking a daily mixture of baking soda and water, under medical supervision, may help shift the body's immune cells from a pro-inflammatory state to an anti-inflammatory one. This change supports the spleen's function, a key organ in regulating immune activity, and encourages the production of regulatory T cells that help keep the immune system balanced. While baking soda is not a magic bullet, its anti-inflammatory properties may offer a gentle, accessible way to improve immune health when used responsibly. It's important to talk with a healthcare provider before starting any regular baking soda regimen, and especially for older adults or those with kidney, heart, or blood pressure concerns. To try it safely, mix a quarter to a half teaspoon of baking soda in a full glass of water. Drink it slowly and no more than once a day, and only after checking with your doctor, especially if you have high blood pressure, kidney issues, or take medications. Baking soda isn't just for baking. It's a hidden gem for senior wellness. From digestion to joint support, these simple remedies could make a big difference. But always remember, natural doesn't mean risk-free. Speak with your healthcare provider before making it part of your routine. Like this video if you learned something new. Comment below, have you ever used baking soda for your health? Subscribe for more senior health tips, natural remedies, and healthy aging strategies.